Hi, folks. My name is Aunty Serwaa, and I'm your friendly guide through some pretty big and complicated topics. Today, I'm here to help us explore the topic of abortion. There is a lot to say about abortion, so I'm going to do my best to talk us through some of the most important facts to help make it clear and easy to understand. First off, abortion is a very personal decision, and only the person who is pregnant can know what is best for them. For anyone dealing with an unintended pregnancy, talking with a trusted adult can help to figure it all out. And I'm here to help too. So let's start with some of the basics. When a person gets pregnant, they have three options. They can carry the pregnancy to term and raise the baby. They can carry the pregnancy to term and place the baby for adoption. Or they can end the pregnancy by having an abortion. You see, there are lots of reasons a person might have for making any one of these decisions. If someone decides to get an abortion, it might be because they don't want to have a baby, or maybe they can't afford to raise a child. Maybe they are in school and they are worried they won't graduate if they have a baby. Sometimes people already have children and they don't want any more. And sometimes there might be something wrong with the fetus. Either it's not developing properly or has a serious incurable disease. Whatever the reason, it's up to the person who is pregnant to decide what's best for them. An abortion is a very safe medical procedure. There are two types: medication and surgery. A surgical abortion is a short 30 to 45 minute procedure that takes place at a registered clinic or hospital and is performed by a trained healthcare provider under local anesthesia. The vast majority of surgical abortions are done during the first few months of pregnancy. During this simple procedure, the healthcare provider uses gentle suction to empty the pregnancy tissues from the uterus through the vagina. This process is called the manual vacuum aspiration, MVA. Most people say the procedure feels like strong menstrual cramps, and contrary to its name, no surgery is actually involved. A medication abortion is a procedure that uses pills prescribed by a trained healthcare provider to end a pregnancy. It can be started either in a medical office or at home. This approach is most effective during the first 3 months of pregnancy. Medication abortion consists of two medications that first stop the pregnancy from growing and then cause cramping and bleeding to empty the uterus through the vagina. Most people say medication abortion feels like a really heavy cramp period. Okay, so those are the basic facts about the physical side of abortion. Now, let's talk about the legal side and what you need to understand. There are many laws pertaining to abortion, and every country's laws are different. In some countries, abortions are legal but illegal in other countries. In Ghana, young people can decide on their own if an abortion is right for them with or without their parental involvement. Research your Ghana laws on abortion to better understand your rights. Abortion can be controversial, and it's something Ghana has been debating for a long time. In fact, some people feel so strongly about people not having abortions that there are places that provide fake abortion care services. There are fake clinics that exist only to try to talk a person out of having an abortion or cause them to have incomplete abortions. They look and sound like real abortion clinics. So, make sure you ask if they provide the services you need and want before you go to one of these fake clinics by mistake. So, while some people don't believe in abortion, others believe a pregnant person should be able to have an abortion and not be judged by others. After all, every person should be able to decide what's best for themselves, their family, and their future. I know we've covered a lot of information. Remember, if you feel confused or overwhelmed, and if you are in Ghana, talk to PPAGC and Casa Contact Center on toll-free and WhatsApp for all your pregnancy option needs. And if you need to come back and watch this video again, I will be here waiting to explain it from the beginning.